have next Amardeep Singh Lotay from University of Manchester. How are you, Amardeep? Wait till you come to the front. And Amardeep will be speaking about how significant are factors that affect absorption of levothyroxine, I think, in the management of hypothyroidism. Yeah. Not my area, but really interested in hearing you speak. And I'll be over here just to help you with timekeeping.
Thank you. So, so my name is Omar. Today I'm going to be talking to you, like Benji said, about how clinically significant are factors that affect the absorption of levothyroxine in the management of hypothyroid patients. So a little bit about my background. Firstly, I'd like to ask, do any of you know what a physician associate is? Can I just see a hand of raise of hands? Good. So quite a few people. Usually when I say that, not a lot of people know what a physician associate is. I'd like to explain what a physician associate is. It's a new role within the medical system. Physician associates are medically trained healthcare professionals who work alongside doctors to provide a continuity of care for patients across the UK and in other countries such as America, Canada, and New Zealand. They work in both primary and secondary care, meaning your hospitals and GPs. Although PAs aren't doctors, they do perform many of the same tasks as doctors do, but they still work underneath the supervision of a named senior consultant. Some of the steps to become a physician associate is that you have to do an undergraduate degree. So I did my undergraduate degree at Aston University and I graduated from there in July 22. I then went on to the University of Manchester where I did my physician associate studies. It's 24 months consecutive, no breaks, no holidays at all. And then earlier this year, I was successful enough to sit and pass my national exams at the Royal College of Physicians. Early last week, I actually got invited to join the GMC and got given my GMC number 2. So if there are any doctors or consultants in the room that want to hire me, I'm available. So what is hypothyroidism? So I'm just going to go into this into a little bit of detail. So in our neck around this sort of area, we've got a gland and it's called the thyroid gland. The thyroid gland is very important for the body. It secretes important hormones that our body needs. To keep it quite simple, I'm going to call them T3 and T4 or thyroxine. These hormones are really important for your body as it helps produce metabolism, it helps enable metabolism, growth hormone, heart rate, temperature, and it's all controlled from the brain. And I'll show you in the next slide what I mean by that. Hypothyroidism is the condition where there's insufficient amount of that hormone being produced in the body, and because of that, patients can therefore get symptoms, and these symptoms include fatigue, weight gain, cold sensitivity, constipation, that kind of thing too. It's usually diagnosed with using blood tests, TFT tests we call them, thyroid functional tests, and we measure something called the TSH levels, which I'll go into a little bit more detail about in a minute. It's important to note that 5 to 6% of European population suffer with hypothyroidism, so it is a really big sort of condition out there that a lot of people do suffer with. So if you look at this diagram here, this is sort of in our brain. We've got the hypothalamus, which secretes this TSH hormone. This sort of indicates the thyroid gland from our brain to produce more thyroid hormone. When the thyroid gland isn't working properly and it's not producing that hormone, this sort of negative feedback cycle increases and ramps up the production of TSH, and basically nothing really happens. You just get loads and loads more TSH, but no hormone which is being produced. So that's why it's an important marker when we're looking at hypothyroid patients. So the current management in the UK consists of how we treat hypothyroidism is that we give a synthetic hormone, and that's called levothyroxine. It's a tablet that patients take, and it sort of supplements that hormone that their body is lacking. Between the 4 years of 2016 and 2020, we distributed through our pharmacies nearly 260 million packs of levothyroxine. So you can sort of see how much this medication is used and how many patients rely on it. Achieving optimal thyroid control and to get them into the right therapeutic range. So what I mean by this is when patients take the medication and we check their blood results to see where their levels are, 30% of patients struggle to actually achieve that, and when they don't achieve it, it usually means that they're still symptomatic of hypothyroid symptoms like fatigue and tiredness and low moods and whatnot. Compliance rate is also an issue with this medication, where 66% of patients take it properly, leaving 34% are not adhering to taking the medication correctly. I guess it sort of happens to everyone, but my sort of research looks into is there like a bigger picture behind that. The malabsorption, like I mentioned before, of this hormone can leave patients undertreated, and it can become quite dangerous. They can go into thyroid crisis, and my research sort of looks at what factors affect the absorption of the medication and what we can do to potentially change that. So this is sort of my research that my results that I yielded from my dissertation. I'm not going to go into like the depth of every paper and bore you with all of that detail, but I'm going to split it into 3 sort of main themes. So it's administration and timing regimes, levothyroxine formulation, and by that I mean tablets or liquid or soft gel tablets, and also the interaction between dietary things that we eat, so coffee and vitamin C I will focus on. So at the minute, this is taken from BNF. Now the BNF is something that all medical clinicians sort of use and how we prescribe medication. It says on here that the dose should be taken preferably 30 to 60 minutes before breakfast, caffeine containing liquids and other medications. Now the word here, they've used preferably, which I think is quite ambiguous, and a lot of patients might think it's a bit ambiguous too. Does that sort of mean that you should take it, or it's okay if you don't take it before 30 minutes, you know what I mean? This is sort of mirrored by the EMC, which a lot of pharmacists use too, where they use the word usually. I think it says on there. Yeah, usually. Again, this can lead to confusion with patients, and it sort of begs the question, why are these vague words used? Research also indicates that taking levothyroxine at bedtime can lead to better absorption. So if taking the medication at night is better for you and you absorb more of that medication, why are we not telling our patients this? And why is it that they're sort of saying take it in the morning? It's one of the things that guidelines haven't yet reflected, and is it time that they should? Given that this was a common trend, that taking it at like bedtime is sort of better for you. So some of the studies at the minute aren't very good studies in the fact that they have flawed trials and they have small sample sizes. So the results here, again, I won't go into too much detail, but we can all appreciate that these box plots here are very, very much similar to each other. These are like different times before bedtime correctly. They're all very, very similar. In fact, they don't actually show any significance, so we can't clinically properly prove it at the minute that it should be changed. But again, more trials should be needed for this. All of the studies that we looked at all emphasise the importance of patients to adhere to levothyroxine guidelines when taking the medication. So they should be listening to what their clinician is, advising to them on how to take the medication. Some research also shows that prolonged fasting. So we looked at trials. I looked at trials that, especially in the Muslim community, when they fast, and how that affects when they take the medication. It actually shows that when you fast and you break your fast and you have the medication with the food and dietary requirements, people actually have raised TSH levels, meaning that the thyroid isn't very well controlled in this area. I'll move on to levothyroxine formulation. So like we mentioned earlier, 30% of patients really struggle to reach this therapeutic range that we want them to be in, and this is causing them to have chronic hypothyroidism, which can be quite dangerous. This literature review found that soft gel and liquid formulations of this medication can actually benefit patients when compared to traditional tablets. So I've got a table of results here, taken out my dissertation as well. If I just point your attention to this here, this is tablets here, and this is soft gel. These are patients taking the medication correctly 30 minutes before breakfast, and these are patients here who are not taking the medication correctly. As you can see, the tablet form of the medication, when patients are taking it correctly, their TSH levels aren't too high, but when they're taking the liquid or the soft gel, their levels are quite low, showing the greater absorption, right? What we can see is that when patients aren't taking the medication correctly, not listening to the rules that their clinician is sort of explaining to them, their TSH levels rise. And at the minute, these levels have risen to 2.3, which is sort of in the range. But if we leave this patient for like, say, 2 weeks, 3 weeks, a couple of months, they can get seriously ill. What's important to highlight in this result, and if you want to take anything away from this table, is that is that with patients that take the liquid and the soft gel formulation, you can see that this result here of TSH value is actually lower than the value of when they're taking the tablet correctly. Given that this is a fact, and this is what our data is significantly showing, why is it that our patients are still given tablets and not given soft gel or liquid formulations? As covered before, some of the benefits from taking liquid formulations are decreased TSH values, more stable, less dose changes and whatnot. Currently under the NHS, these medications like liquid and soft gel are available to patients, but only patients that have got problems with their bowels and they haven't had bowel resection, so they haven't got much bowel to sort of absorb it. In Italy, soft gel formulations are available to the general public, but it comes at an added cost. So my sort of question is, given that this is the case, as the NHS, we spend £30 million annually on thyroid functional tests, and a lot of that is to retest the patients to make sure that the medication is working. A lot of that cost as well, the way that we fix, if you're not absorbing medication properly, we just give you more medication and it keeps getting higher and higher. If we sort of fix the problem and give patients the less amount of medication but the right formulation, it's sort of like, where's the comparison in cost? Is it a benefit or is it a weakness in that sense? It's something that the NHS should cover. Finally, I'd like to finish on interaction. So who in this room drinks coffee? Yeah. Who's not had coffee for a little while and then had coffee and then had an upset stomach? Most people. So coffee is very disruptive to our gut, and in the guidelines it's not disputed at all when taking this medication, and if you take coffee soon after, our gut, what happens is that it disrupts our gut, so you're not going to absorb much of the medication. So it's very important that you do wait 30 minutes at least before taking this medication to have your coffee, which is kind of annoying because if they're telling you to have the medication in the morning, I don't know about you lot, but I like to have my coffee in the morning too. Do you know what I mean? So it's a bit difficult. An important thing to note about this is that as healthcare professionals, when we're going around our ward rounds in the morning in the hospitals, we're giving patients their morning medications, and they usually have it with a tea and coffee. You know what I mean? It's a bit of a joke. So as healthcare professionals, are we really advocating and doing the best for our patients in this way? It's something that we should really think more carefully about. And finally, it's not all doom and gloom. Vitamin C interacts, actually increase the absorption of levothyroxine. Now this is fairly new, and there's not a lot of research into what the mechanism behind this is. It's not really understood very well yet, but we just can figure out that vitamin C sort of relaxes your gut, and it sort of allows for less hostile environments for the medication to get absorbed. Research has also shown that people with inactive thyroids and thyroid cancers, vitamin C is helping towards that to rejuvenate the thyroid. So there's a lot more research needed in this area. So I guess my takeaway messages are that obviously thyroxine hormone is a vital hormone for your life, and it's essential for everybody. I think larger, high quality studies are needed. We need to have bigger controlled studies to sort of test for all of these informations that I've mentioned earlier. And I think that clinical guidelines such as NICE and EMC should really update their guidelines on how the medication is prescribed and look into this research more. I think the NHS should commission a new report, similar to the one they did in 2019, which focused on hyperthyroid, which is when you've got too much hormone. I think with a greater focus on hypothyroidism, we can sort of look at this a lot better. This sort of report covered the costs of the medication, costs of testing, and sort of tying up what medication is best to give. As medical professionals, and I do say medical professionals quite a lot because I submitted this to my medical school before, even all of us sat here, we might have parents, we might have family members that take thyroxine. I think it is important that we sort of, we might take other medications as well. It's very important that we sort of have a look and see what interacts with a medication and what sort of interactions these can have, and what we should be doing and changing in our life, whether it be dietary requirements or how we take the medications to better, support ourselves and our families. And as mentioned earlier, the switch between tablet form to liquid and soft gel is something that the NHS should consider, and they could potentially save money, or it might be the same amount of money they're spending. And finally, I think it's very important that we advocate for our patients and to make sure that they receive the very best possible outcomes with their treatment in whatever setting. Thank you so much for listening.